Welcome to the Getting Started webinar for healthcare support workers that are working in long-term care and assisted living facilities. This webinar is for healthcare support workers. There are three topics we'll be talking about today. First one is long-term care homes and assisted living facilities in a general sense, which are two places of employment where healthcare support workers are located. The second topic is the Learning Hub. We'll learn about how to create an account in the Learning Hub and how to enroll in the provincial online orientation curriculum that you need to do before you begin your work at your long-term care site or your assisted living facility. The third topic is the healthcare support worker role. We'll learn in a general sense more information about the kinds of duties you can expect to be performing when you start your work. Long-term care homes. Long-term care homes and assisted living facilities are facilities that are designed with the residents' needs in mind, and they're found in all communities within our region. There are laws in British Columbia that govern how these facilities operate and what services they must provide. Long-term care homes are licensed under the Community Care and Assisted Living Act or the Hospital Act, and they are inspected routinely. Long-term care specifically provide long-term care for adults who can no longer live safely or independently at home due to their need for 24-hour nursing supervision in a safe and secure environment, and their unpredictable or high-intensity care needs, which can no longer be managed at home. Long-term care is not a housing alternative, but a clinical care service, and it's considered one of the last options in an adult's journey. Assisted living is a personal care and support services for adults who can live independently. Residents typically live in suites or apartments furnished with their own furniture and belongings, and they maintain a great deal of independence and privacy while being supported with some services. The words care and assisted in the title of this slide refer to person-centered care philosophy, which means placing the individual, not just their needs, as the focus. We care about the person's histories, values, culture, preferences, and we try and accommodate. We want to get to know them as people first, and then caring for their needs. We know that in long-term care, approximately 85% of residents at this point have dementia at various stages. So there is a huge need to care about their safety and security as well. In assisted living, the goal is to assist or support residents to remain independent. They have their own apartments or suites, but may need assistance with services like medications, housekeeping, some laundry services, meals, and the goal is really to give residents choices whether to participate in these activities or options for them. Who are the residents? We've mentioned that long-term care homes are designed for adults who can no longer live safely or independently because of their complex care needs. And in assisted living, there are residents who need additional support to maintain their independence. The facilities are for individuals over the age of 19, and there are three types of employers within long-term care and assisted living settings. There are those employers that are Fraser Health owned and operated facilities. There are those that are affiliated or have a not-for-profit relationship with Fraser Health, and there are those that are private. With assisted living, there are facilities that provide what's called a campus of care, typically spaces that have increasing levels of care or services provided for residents as their needs increase over time. As a healthcare support worker, you might work with residents from all of those or from any one of those particular organizations. What kinds of services are found in long-term care and assisted living? In long-term care, residents need help with activities of daily living, like bathing, feeding, or dressing. They need 24-hour personal care assistance and support, skilled nursing care, meals, basic laundry services, and recreational activity programs. In assisted living, the services offered are optional, as mentioned. but they include things like meals, assistance with medication management, laundry services for linens and towels, housekeeping, and social and recreational activities. It is recognized that providing care for residents has been difficult, and none so much so as in the past year and a half. So the government of British Columbia and Fraser Health have created supports and resources to support care providers such as yourself. You will find this particular website is produced by the government of British Columbia, and you'll find it at this web address, careforcaregivers.ca. This web page is accessible to the public and contains well-being and psychological supports, including COVID-19 mental health supports. Some presentations or webinars that you can attend, both live and those that are recorded. In addition, as you can see here on the screen, there's a confidential peer support for healthcare workers. Similarly, Fraser Health has created a web page and curated some resources for care providers, including healthcare support workers. You will find the page here at www.fraserhealth.ca, Your Health Matters. And while many of the resources on this page refer to supports for Fraser Health, there are a number of these that are accessible to the public as well, including some COVID-19 mental health and well-being resources. We encourage you to check out these two pages for your own interest and benefit. The next topic I'm going to talk about is the Learning Hub. You would access the Learning Hub by going to entering this web address in your search box. The Learning Hub is like a big catalog. It provides classroom and online training opportunities for learners throughout British Columbia. It's open to healthcare employees, physicians, students, and volunteers, and some courses are open to the public, like this one that we're going to be talking about today. Important to access the Learning Hub through Google Chrome, both to create an account and to take the actual courses. Mobile devices can access registration and account activities, but the online course does require a desktop or a laptop computer. So we're going to walk through how to create a Learning Hub account and how to enroll into the curriculum. After you click Sign Up for an Account link, this is the page that you will see next. It's important to use an email that you can readily access, because a verification email will be sent to that email from the Learning Hub, indicating that someone from that email has requested to create an account. And you'll need to be able to click that verification link in order to complete the creation of an email account, an account. As part of creating your Learning Hub account, you'll need to indicate that Fraser Health is the organization that you either work for or are affiliated with. In addition, you'll need to answer the question, what best describes your role? In this slide, you would select if you work for Fraser Health, that you work for the health organization employee. If you work for a contractor or affiliated organization, you would identify affiliate or contractor as your selection. Once you've created your account, you can log in and then enter this number in the search box. 24230 is the course number that will take you directly to the curriculum, the link for the curriculum that you're required to take. It is called the Curriculum Provincial Standard Healthcare Support Worker Orientation Program. Please notice this curriculum is expected to take 22 hours and 20 minutes. So it is lengthy. It actually contains 18 courses, 18 individual courses, and you will need to take all 18 courses in order for the curriculum to be considered completed. When you get to the landing page of the curriculum, you need to select Enroll in Curriculum. Notice here in the center of your screen on the landing page, you will also see that beside each course, there is a Start Course button, and you'll need to select that Start Course button in order to actually begin taking each one of those 18 courses. After you complete all 18 courses, the curriculum is considered complete, and you will receive an email from the Learning Hub confirming this. This curriculum is considered required learning before you report to work, and it is important to complete it. Because it's lengthy, it is important to pace yourself and to think about ways that you can take care of yourself while you're watching the videos and listening to the tapes. The curriculum does contain 18 courses, as I mentioned. Some of the individual courses within the curriculum also issue course completion notices. However, it is the final course completion notice that is needed in order for you to indicate that you've completed the whole curriculum. That final email you can either print or show to your manager as evidence or proof that you've completed it. And that is what is needed for your reimbursement for that 22 hours and 20 minutes. This is a suggested strategy for learning. Partway through taking and watching the videos and the material, it is suggested that you stop the tape and share what you're learning with someone in your space, a friend, a colleague, etc. The idea here being that we tend to learn something on a deeper level when we have to teach it to someone else. And generally what will happen is some questions will come to the surface. Be wondering about, well, how do we do something? Or what about something else? Those are excellent questions to take back. That's what we call a process of reflecting. Those are questions that are really important for you to take back to your supervisor or your manager at the work site and have them address them for you. This is especially true if you're new to healthcare. There's a lot of new concepts and a lot of new information. So thinking about it and asking questions is going to be one of the key ways that you will learn new information. Once you've completed the curriculum and you have your course completion notification, I'm going to ask you to log back into the Learning Hub and go back to the same landing page. This time, we do not want you to enroll again. What we want is for you to select this link on the landing page that says Additional Provincial Online Requirements and Safety Resources Checklist. This checklist, as you can see, has additional safety resources. Look like this. These resources are some of them are hyperlinked. In other words, some of them you can click on them and find them easily from the BC Centre for Disease Control. Others are specific to your particular place of employment. But it is important to have these matters all completed as part of your orientation. Check with your manager or supervisor if these need to be completed before you report to work or to be done while you're on at the work site. Once you've finished the provincial online curriculum, then it's time to report to the work site. At the work site, there will be site-specific orientation. Here are some of the topics that will be covered. This list is not complete. There will be many more topics on that checklist that I just showed you. So matters like payroll, what your dress code is, introduction to staff teams, your specific job duties, site tour, and access. Those are all some of the topics that you'll be covered, that you'll be oriented to. The next topic for discussion is the role and responsibilities for a healthcare support worker. This role is considered non-clinical and non-direct care. And as a healthcare support worker, it's required that you're supervised by a regulated health professional. That would include someone like a nurse, or it could be another regulated professional like possibly a social worker in some instance, or a dietitian, someone within the facility that belongs to a regulated college. These are a list of some of the duties you can expect to be performing. The list is not complete. and your manager or supervisor will have the complete list. It is intended to give you an idea of some of the duties you'll be performing. So for example, when it comes to communication, you will definitely be observing and reporting your observations, writing in staff communication books or boards, discussing with team members, listening to a report, which typically takes place at the beginning of a shift, checking the assignment board, but you would not be documenting in a resident's chart or modifying their care plan. When it comes to activities of daily living, certainly you can expect to be escorting people either to the dining room or recreation room, even a patio, supporting them to complete hand hygiene, applying or removing resident aprons, but not performing duties such as taking blood pressure, height, weight, or assisting with bathing or dressing, or providing one-on-one care. In addition, when it comes to meals, you can expect to be sitting with the resident at meal times or to be assisting to deliver nourishments under the care and guidance of a care aide, but not providing hand-over-hand assistance with feeding or resident transfers. When it comes to emotional, cultural, social, and spiritual needs, you can expect to be spending time with residents. Remember that focus about putting the person first. So, sharing time with them by listening to them, by speaking with them, by reading stories or the news, looking at pictures, playing music, cards, or a game, but nothing more than that involves direct care. The next topic to talk about is healthcare teams. Healthcare in long-term care facilities and assisted living is delivered through the use of what we call healthcare teams. These are groups of people, each have a different responsibility, but they work together to provide optimum care for the resident and their families. As a healthcare support worker, you are part of the healthcare team. The direct healthcare team includes, in addition to yourself, it would include nurses, care aides, social worker, dietitian, probably activity staff, and dietary staff as well. In addition to the direct healthcare teams, there are those who provide support to those healthcare teams, like resident care coordinators, educators, managers, supervisors, admin staff. So you can see that people work together in teams to make sure that the residents are receiving the best possible care. A key function of the teams is how well they work together, so communication is going to be key. And you'll be introduced to how the staff teams communicate with one another, what methods they use, and how they document and share information. So for today, what do you need to do after this presentation? If you don't have a Learning Hub account, I'll ask you to log in to the Learning Hub and create one, as was shown earlier. Feel free to play that section of the tape again in order for you to be able to create your account accurately. The second step is to enroll in the curriculum, the Provincial Standard Online Curriculum for Healthcare Support Workers in Long-Term Care and Assisted Living. Those are 2 steps that are expected at the end of this presentation. And then, as time permits, begin taking the courses that are within the curriculum, making sure that you complete all 18 courses before you report to the worksite. There is a community of practice for healthcare support workers in long-term care that meet monthly on the last Monday of every month from 1 until 2 p.m. And their goal is really to connect healthcare support workers around specifically a topic of interest for that particular month. Some of the topics that we've covered so far include things like dementia in the elderly, or people's experiences, healthcare support workers' experiences in their work site. What are some of the things that are part of their role as healthcare support workers? This meeting is for healthcare support workers, and if you wish to attend ask your manager for the Zoom link. It is a virtual meeting and you can attend from your current location. If you have questions on how to create a Learning Hub account, you can send an email to hcap@fraserhealth.ca and someone will reach back to you to provide you with assistance. If you have questions regarding your worksite orientation or anything else regarding your duties, please refer to your manager. Thank you.